to introduce you to the local minister. He does not need any introduction. Our Sebastián Celaya, who is our local health minister, and he has come to open these sessions. Hello, good afternoon to all of you. It is a pleasure for me to be able to be here opening the sessions, because for Aragon and the Health Science Institute is the fact of holding this event in Zaragoza is really a boost for everything that has been done in this autonomous community in Aragon. We are commemorating the 10th anniversary with the fundamental involvement by patients, and this is an opportunity so that experts of different countries meet and assess what has been done in these years. I have to greet Paloma Casado, who is the representative of the health minister. I want to thank her for being here, and I believe that it is the support from authorities on a local level and on a national level is substantial, is fundamental. I also want to thank the European community that is supporting and funding these sessions, but because these results are linked to the executive, to the Consumers Health, Agriculture and Food Executive Agency, CHAFEA. I also want to greet the Carlos III University, which has also facilitated the organization of these sessions these days. The construction of a European health environment is something that we've been working on for the several years. It's been over a decade of joint actions where the member states of the European community have mobilized the capacities of the agencies in order to try to join ourselves on a common goal, which is to foster a network, a European network for health technologies that will be able to combine these needs of all the countries of the area with the innovation, so that we will give a better service to the citizens. It is true that we live in a globalized country where technologies and health products do not know of borders, with a very clear will by the industry in promoting them, to promote the public systems that have been funded with the money coming from all of us. And these new therapies. If we see the offer that has been presented in the latest decades, we can say that innovation has multiplied the options to care for our citizens together with drugs and technologies. But if we focus on analysis, we see that the advances that contribute an increase, a marginal increase in the state of health and the quality of life of our citizens improve substantially with such an offer. And the axis of the analysis of the marginal increase and the opportunity cost of devoting these resources to this type of technologies, instead of using them in other technologies for the public system, the proportion or the ratio of those that are favored by those, but them are smaller. I want to say that I'm very happy because we avoid duplicities, and we are able also to increase the efficiency and the fastness or the speed of these technologies so that they can reach the citizen sooner. And also we can implement the methodological advances that we have, and we increase our capacity to give a response to the demands. And also because the possibilities to activate ourselves are going to be a benefit, to provide benefits to all. And therefore, I'm so happy for this type of collaboration. We, the people who have to manage health funding, always have the problem of deciding upon the innovations that are really efficient and which ones are worth investing. In this sense, the Spanish network of health innovation has consolidated a model that is a reference in the whole of the European Union. And as you know, the network in 2016, the network was 10 years old, and it is a moment to reflect upon all the successes and all the challenges that we have ahead, so that we can take better decisions in the national health system with a model that will help us serve everybody in the European area. We need also a system that helps us see the differences and distinguish the differences between what is important and what is not, so that we will ensure the good use of resources and all the resources that we have decided to devote to this. We are going to assess the latest advances and developments of the network to this, for example, the detection of emerging technologies, the capacity to incorporate promising technologies for which there is not enough empirical evidence, and also the contributions that come thanks to this evidence, or that appear thanks to this evidence, so that we will achieve a very important goal from our point of view, which is incorporating the perspective and the values of patients to the clinical practice guidelines. And tomorrow the session will be devoted to analyzing how to involve patients in a practical way in order to take decisions in the national health systems. Everybody knows that today the pharmaceutical companies know that if they convince the associations of patients, they will be much more powerful when exerting some pressure when using this innovation, or convincing the governments to using these technologies. And therefore, to end this opening session, let me please give you a warm welcome and offer you, all of you, in this room and outside of this room. You see that we have streaming, the knowledge of how this Spanish network works and the advances on the European side, and also harnessing the opportunities that these sessions or days are giving us, or providing us. I wish you a very good session and enjoy your stay among us. Thank you very much.